So for this module, we learned a lot about substance abuse and the opioid epidemic that's currently happening. And so I work and intern at a foster care and adoption agency. And one of the ways that my agency addresses this opioid use, a couple of different ways. So we have a family intervention program, and obviously, the purpose of foster care is to reunify children with their birth parents. And oftentimes the children come into care because the parents are addicted to drugs or some sort of substance. And so that is a huge reason as to why children come into care. And so it has to be a huge part of the treatment and helping them reunify. So how we do that is, or what I'm learning about how we do that, is by working with clients and trying to really encourage them to reach out to their providers, to continue to engage in their treatment, to really help them see the larger picture and motivate them that they're working to get their children back and in their kids' best interest. It's not just about them, but they have other little ones to think about and things like that. On the flip side, unfortunately, reunification is not always an option, and so how we address the opioid epidemic after a TPR happens is by working with the pre-adoptive families and saying, really providing a lot of education about the genetic factors that the kids have that make them more susceptible to addiction, the trauma or neglect that they've experienced, which also makes them more susceptible to using substances, or, of course, a lot of times there's some sort of combination of substance use, neglect and trauma, and mental health issues in the birth parents, and of course that's passed on to the kids. So really by working hard with the pre-adoptive family on how to support them to support the children can help prevent the children from growing up and also using substances, and kind of breaking what's often a generational trend. As well as working with the pre-adoptive family, we also work a lot with the children. There's a program in Delaware called My Life, and we work to help the kids understand their life and why they came into foster care and all of those things. And by working with them, oftentimes we have to talk about the nitty-gritty details about why they came into foster care and why their parents weren't safe caregivers for them. And so talking to the kids about these things in a way that helps them understand, and also hopefully helps the children have the tools and information they need so they grow up and can also break the intergenerational trends. So all of that is working at the micro level with the families and with the children. However, we try to work in the macro level because we have to work, with the government where we get our funding and advocate for resources, for trainings, for policy changes to best support these kids and families. And we absolutely work with the meso level as well. We are constantly working with other agencies, partnering with schools, therapy providers, a whole wide range of, the court system, all of these things. We're all working together for the best interest of the kid and the best interest of the family. So how my agency can provide additional opportunities for prevention and treatment would be to continue to advocate for changes at the macro level, as well as continue to receive training about evidence-based practices to help the families and follow any modules that are provided through the newer evidence-based practices that are coming out. And so my big takeaways from all of the readings and things like that is that this is just a huge issue, and it's not an easy thing to tackle. There are a lot of layers, and it's just we need to create systemic change if we want to address this issue appropriately. It's really difficult to talk to clients about drug use and things like that for me, because it feels like private and personal, and it's a little bit uncomfortable to talk about, and I certainly wouldn't want to offend them and hurt the relationship. So it's a difficult balance between being there to support them, but also being able to give them the tools and have those difficult conversations so that they can have the information to make better choices for themselves and for their family. So that is a little bit about my internship so far and what I've learned and how the opioid crisis affects that, and a couple of things we're doing to help address that as well. So.